Hey guys, Dr. Dex Alvarez here, and I wanted to talk a little bit about sleeping position today. I've been getting a lot of patients. I get this question literally every day. What's the best position I should be sleeping in, especially after an adjustment? I don't want my adjustment to go all out of whack after, when I go to bed at night, or I wake up in the morning constantly with headaches, which that was me for a really long time. So I'll go through kind of why that was causing for me, or every night when I wake up, is my lower back's killing me. So I always get asked, what's the best sleeping position? And the short answer to that is on your back. On your back is going to be the best sleeping position you can be in, because it's going to keep your spine in a neutral position, especially if you can have a bolster or a few pillows underneath your knees where you have a good bend. That's going to alleviate a lot of pressure in your lower back. And then to help avoid the snoring, especially if you have somebody laying next to you that can kind of annoy, like my poor wife, a good 10 to 15 degree head tilt with one pillow or two, and the pillow should be relatively firm so that it's giving you a good amount of support at the base of your neck. Cervical pillows are a really good idea too. Those are the ones that kind of look like a contour. They almost look like a wave. A good cervical pillow should be pretty firm to where you lay on and you're like, you know what, that's just a little bit too firm. That's perfect, because it's eventually going to start to wear in and you don't want to just be going through pillows every month. So just a little bit too firm, it'll break in a couple of nights and it'll be perfect for you. And as far as those contours, it has a low side and a high side. The high side is if you're a side sleeper, which is going to be your second best way of sleeping. That short side is if you're a back sleeper, it should provide just the perfect amount of support for your neck and give you just enough head tilt to help prevent the snoring. So second best is going to be on your side. If you are a side sleeper, you want to have like one of those cervical pillows that has that high side, because that's going to account for your shoulder height. And it's going to allow to give you a good amount of support so that your neck is remaining in a neutral position even though you're laying on your side. Along with that, you want to have a pillow in between your knees. What that pillow in between your knees is going to do is going to maintain your hips in a neutral position, so that as you're sleeping at night, you're not having one side gap open versus the other, which is going to cause some inflammation in the capsule and eventually can lead to lower back pain and sciatica type pains. So the worst is always going to be on your stomach, unfortunately. I was a stomach sleeper for a long time. It took me about 2 years to figure out how to sleep on my back. And that was just by wedging pillows on myself so that I couldn't turn side to side. But the reason why stomach sleeping is so bad for you is A, it doesn't provide any support to your spine. And B, when you have your head turned to one direction for 6-8 hours at a time, unknowingly you're creating muscle memory. Your muscles have no idea if you're asleep or not. So when you have your head turned to one side all day, all your muscles know is all this side needs to be short and all these need to be long. So that's why throughout the day, you're not doing this, but your shoulder will start to rise. So that's when you could start to lead to misalignments in the shoulders, leads to a lot of neck pain, arm, hand, shoulder symptoms, and how I used to wake up every morning with a terrible migraine. So those are your best sleeping options. As far as mattresses, that can also vary, and that's going to be patient to patient, depending on how you sleep. If you're a back sleeper, which again is the best, you should have a firmer surface. That way you're getting a lot of that support. If you're a side sleeper, you're probably going to want to lean more towards a medium firm, so that way you have a little bit of sink for your shoulder. But these are, again, rules of thumb. The best thing to do is when you're looking for mattresses, have somebody go with you, take a look at you as you're laying down, and make sure there's absolutely no space between you and the mattress. No one should be able to come up behind you and slide their hand between your back and the mattress. That's going to provide the correct amount of support for your spine as you're sleeping. So that way you can make your nights as restful as possible, and you're getting the best night's sleep, so that way you're recharged and ready to tackle the next day. So I hope this clears some stuff up. Have a great rest of your day. We'll talk to you soon.